Well, you probably heard of the Bible Belt, but what about the stroke belt? According to the American Heart Association, South Carolina is in that belt. And now they have a new program along with MUSC designed to inform and prevent strokes. Dr. Robert Adams is here with much more. Dr. Adams, thank you for being here. We really appreciate it.
Thank you for having me.
Stroke prevention, really #1 in your book. Tell us about the MUSC program that's going to help really change the lives of patients.
Well, this REACH MUSC program that we have developed allows us to help emergency rooms around the state provide prompt and competent and expert care for stroke. The issue with stroke is you have a very short time window to get the right treatment, and that treatment has to be initiated within 3 hours of the onset of symptoms. So many of these emergency rooms don't have access to experts in so-called vascular neurology or stroke care. And we can then, with this program, using the internet, we can be in their emergency room, virtually speaking, within 10 minutes. So when we do this, we then help them evaluate the patient. We see the patient, we look at the brain imaging, we talk to the family, and we help them decide if this special drug called TPA is indicated for that person. And the reason we can't wait and say, well, why don't you send them to Charleston, is by the time they get here, they would be outside of that treatment window.
So this is a virtual diagnosis almost.
We help them diagnose and decide if this drug is appropriate for them. The reason you don't just give it to all of them is that the drug has a complication rate that's significant. Since it breaks up a clot, it could cause and can cause bleeding. So it's important that the right person get this in order for them to benefit from this. We know that not enough people in the United States, particularly in the South, get this drug. The drug's been out since 1996, and we're still trying to get it as available as possible. It's not hard to give, just give it IV. The question is who to give it to, and to help the emergency room physicians in these hospitals that are doing this great work out in the community to help them do that better. We want to partner with them, and that's what we've done with this MUSC program.
Exactly. We want to go back to that drug. You say it's given after a stroke to prevent that clot.
Well, actually, it's given after the stroke to prevent the damage that the clot causes. The clot has already formed. The body has a way of breaking up the clot, John, but it just doesn't move fast enough. So what this drug does is it helps accelerate the clot breaking up. I think the video that we have shows that very well. If we can.
We're seeing a picture of it right there. Doctor, I also want to ask you, this is when it's not too late, but this is the later stages. There are things you can do to prevent stroke as well.
Absolutely. If you have a heart disease, a certain kind of heart problem, particularly atrial fibrillation, then you need to be on preventive medication that would prevent the clot that you just saw being formed at all. That would be a good example of a clot maybe that's formed in the heart that's thrown up to that area. Now, if we could show the second clip, we could show what happens when you give the TPA. Now see, there's the drug coming in, and that is called tissue plasminogen activator. It's not important what that is, but it helps break up the clot, and you can see now the clot's breaking up and the flow is being restored. Now we also have ways of mechanically opening that up if the TPA either can't be given for whatever reason, somebody has a bleeding disorder, or it doesn't work. If the clots are really big, sometimes we have to do that mechanically, and we have people at MUSC who can do that.
Indeed you do. All right, Dr. Robert Adams, thank you so much. It's been fascinating. We
Thank you,
appreciate your time here. Thanks a
Thank
lot.
you.
Good luck. All right, next up, we're back with Dr. Edmund Rett of the Rett Women's Center. Stay with us. But first, we want to get to your phone ready. It's Food Lion Trivia time. Can you answer this question? What fruit is the only fruit that bears its seeds on the outside? Interesting one. Caller number 4 with the correct answer was a $25 Food Lion gift card. Call now at 849-2535, and good luck.